Well, hello, everyone. Thank you for joining us for our virtual open enrollment fair session. At this time, we will go over UnitedHealthcare medical benefits for plan year 2024. Before we get started, I would like to brief everyone on a couple of housekeeping items. All attendees are muted and will remain muted throughout the presentation. If you have a question, please type it in the chat box located on the right-hand side of the presentation screen. Be informed that if you type a question in that chat box, everyone attending the session will see your question and your name. So if you have a question that is sensitive or confidential in nature, we recommend that you reach out to the County Benefits Division or your benefits ambassador within your department. Lastly, today's webinar is being recorded. A copy will be posted on the Benefits Open Enrollment website. At this time, I will turn it over to our presenter, Matt Ogden.
Thank you so much, Nidra. Good afternoon, everybody. My name is Matt Ogden. I am with California Schools VIBA, and we are here today to talk to you about your open enrollment for 2024. So we'll get started. We have a lot of information to go over today. So we're going to talk a little bit about the UHC product review. So this is going to be the different HMO plans that are being offered, along with the additional services being a UnitedHealthcare member. We're going to go over the the UMR PPO plan offering and the additional services through UMR. And then we're going to talk about your pharmacy benefit manager, which is Express Scripts. We'll go through the details of utilizing Express Scripts, and then we'll touch base with the additional benefits that you have being a VIBA member, along with our contact and support resources. We are kindly asking that questions and answers, if you have any, please submit them into the chat, and we'll be happy to answer them. We will do a Q&A at the end of this presentation so that we make sure and answer all of your questions. With that being said, I'd like to go ahead and begin with UnitedHealthcare. So we're going to go ahead. I'm going to turn it over to Nick Cruz to talk to you about your UnitedHealthcare benefits.
All right. Thank you, Matt. And hello, everyone. My name is Nick Cruz, and I am a field account manager with UnitedHealthcare. And today I have the pleasure of going over all of the wonderful benefits available to members who choose a UnitedHealthcare plan today. All right. So as always, we like to provide some reminders about the requirements of being enrolled on an HMO plan. Such as members must choose an in-network primary care physician from any of the participating medical groups in the plan network that you select. Plan selections are required at the time of enrollment and are locked in once you make them for the year. Members must enroll with members enrolled with a family are able to select different medical groups within the same network you select. For an example of that, let's say a subscriber elects UCSD as your medical group. A spouse or a dependent can elect Scripps Clinic when it comes to the Alliance network, because both of those medical groups are within Alliance. So for medical group, when it comes to medical group changes within a member's plan network, those changes are allowed for primary care physicians, as long as it follows the UHC guidelines for those changes. We follow a rule known as the 15-30-day rule, which basically means if you call in to request a change before the 15th of the month, that change is effective the 1st of the following month. If you call into UnitedHealthcare after the 15th of the month, that change is effective basically a month and a half out, so a month following the next month. So you always want to make sure, if you're looking to make a change to your primary care physician and you want it done as soon as possible, you want to call in before the 15th of the month. Now, there are some exceptions in certain instances, but to make sure that you get that change effective the 1st of the month or as soon as possible, try to always call in before the 15th of the month. One of the extra added, there is UHC supports qualifying events or life events within the year. So this is basically allows for changes throughout the year within the networks, or adding and enrolling individuals. All right, next slide. Oh, there we go. So here we have an overview of the first plan offered by the County of San Diego, which is the Performance HMO Network 1 plan. So good news here. There are, for those already familiar with the plan, there are no changes for the 2024 plan year. The copays will remain the same. So the PCP and specialist copays will remain at the $25 copay. Urgent cares will again remain at the $25 copay. ER visits have the $125 copay, and if you are admitted to the hospital, your copay is $200. There is no deductible on this plan, and your out-of-pocket maximum is $2,000 for an individual and $6,000 for the family. On the right-hand side there, you'll see some of the participating medical groups within the Network 1. So you'll see some of the Optum medical groups. There's also Rady's, the Sharp medical groups that are available as well, including Sharp Community, Sharp Community Graybill, the Sharp Re-Steely. So those are just some of the ones, to name a few, that are available in the Network 1 plan. Thank you. Here we have an overview of the Alliance plan. So there will also be no plan changes to the Alliance plan. All copays will remain the same. PCP copay for this plan is $25, and your specialist will be $40. Urgent cares are also the $25 copay. ER visits have the $125 copay, and if you are admitted to the hospital, your copay is the $200. Again, there is no deductible on this plan as well, and your out-of-pocket maximum is the $2,000 for an individual and $6,000 for the family. Alliance is the go-to choice for members looking to enroll in a Scripps with the Scripps primary care physician. So a lot of the, as you can see on the right, in the San Diego area, you'll notice that Scripps Coastal, Scripps Clinic, Scripps Physicians, as well as Mercy Physicians Medical Group, which is a Scripps affiliate, are all available on the Alliance network. Now, this network also includes UCSD and Rady's. All right, so here we have the Harmony High Deductible Health Plan. This plan will be HSA compatible, which basically combines the medical and RX accumulators. So to clarify, basically what that means is it's combined accumulators means that the RX copays from Express Scripts will be included in the medical deductible and out-of-pocket limits on the medical plan. There will be two versions of this plan. The first version will be for individuals only who are enrolling on the plan with no dependents. The individual-only plan will have a $2,700 deductible and a $3,200 out-of-pocket limit. The family plan will apply to any member enrolling with one or more dependents. And the family plan will also have the family plan has a $3,200 deductible. The out-of-pocket maximum is $3,200, and the family out-of-pocket maximum is $6,000. And just to add in there that the deductible does apply to the out-of-pocket limit. So for those who aren't as familiar with what a deductible and out-of-pocket limit mean, a deductible is the amount a member is responsible to pay for medical services prior to the plan or UHC paying on claims. The out-of-pocket limit is the maximum amount a member will pay in a calendar year. So once the out-of-pocket limit is reached, UHC will cover 100% of the claims incurred. All right, so diving into some of the taking a look at some of the benefits there. There's a grid there with the copay and information. So you'll see the PCP visit and the ER will be a 10% copayment after the deductible is met. This means the member will be responsible to pay in full, the deductible in full until they pay until the deductible is satisfied. Once the deductible is met, you will only be responsible for 10% of the allowed charges per service. Now, for preventative services, this isn't the case. Preventative services will be covered at 100% on this plan. They do not apply to the deductible or have that 10% co-insurance, co-payment there. On the right, you'll see the available medical groups in the Harmony plan. This will be, again, Sharp centric, so there'll be majority of the Sharp medical groups available in Harmony. UCSD is there, as well as the Optum network, the North County facility, which was, again, this was previously, for those who are familiar with Primary Care Associates, that was the previous medical group, but it's now known as the Optum Care Network North County. All right, so here we have just a bit of a comparison between all of the plans by the cost, to just give you a side-by-side of what the plans are for your basic services that you go to and receive on a regular visits. So for instance, again, with your PCP visits, those on the Network One and Alliance plan, they both have that $25 copay. For the Harmony, it's again the 10% copayment after the deductible. So once you pay your deductible in full, you're only responsible for 10% of the charges until you reach out-of-pocket maximum. And then again, you'll see that the same is pretty much along the board, across the board, excuse me. Specialist is the only one that kind of varies a bit, where that Alliance has a $40 copay, but the other two remain the same when it comes to your office visits. So your $25 and then 10% copayment after deductible. So again, just gives you a bit of a side-by-side view when you're making your decision to help out there. All right. So as I mentioned earlier, a bit about preventative care. It's just a reminder, all plans offered by UnitedHealthcare offer preventative coverage, covered at 100%. Again, this is all networks. We highly recommend members to take advantage and receive all their preventative care services at zero cost to you. This includes immunizations, vaccines, health screenings, annual physicals, any screening that you need throughout. So again, please talk to your primary care physicians about utilizing these benefits and taking advantage, because again, it's 100% covered on your plans by UnitedHealthcare. All right, so jumping right in here, we have the custom UHC County of San Diego dedicated member website. That website is listed up there, the yuhc.com/COSD. There's no username, email, or password required in order to enter the site. It is available for existing members and potential members. So this is where you can view all of the plan options. You can find all of our in-network providers, hospitals, urgent cares, ERs, and also a variety of wellness benefits and a lot of just general great information if you're looking to join the UnitedHealthcare plan. So as I mentioned, the site has a provider access search tool, and that search tool is broken down by the individual network that you're looking to enroll into. So if you're looking at a specific plan, let's say that the Alliance plan, for instance, when you go onto the site and select the plan options, you can select Alliance specifically, and what it does is it will pull up all of the available providers in the Alliance plan only. All you have to do is input in, whatever you're trying to narrow it down by, your zip code, an address, or even a doctor's name to verify if they're in network on there. So it makes it really simple for you to find out who's in network on the specific plan that you're looking at. So again, if you're looking to make a change, enroll in UnitedHealthcare, any of those, I highly recommend utilizing this to verify if your doctor's in network. All right. So we understand at UnitedHealthcare that transferring to a new medical group, or let's say from one carrier to another, if you're looking to make a change, can be sometimes somewhat scary. There's a lot of questions that go into making those changes, such as selecting a new primary care physician, scheduling your first PCP appointment, transferring medical records from one medical group to another, or a carrier from one carrier to another, prescriptions. A lot of those are the worries that members have when thinking about making a change. We want you to know that we're here to help you, and our goal is to make that as simple as possible for you. So we've partnered with medical groups and found out all of the information or the answers to all of those questions for you within the given medical groups to really simplify that process. So what we did is we put together a bunch of information and provided it to not only the VIBA advocacy team, but also our internal member services team. So that way, when you're looking to make that transition, these areas can provide you all of the information you need to make that process as smooth as possible. So if you're looking to make any of those changes in this plan year, again, whether it be moving from one carrier to UnitedHealthcare or within UnitedHealthcare from one medical group to another, please reach out to the advocacy department. Their phone number is listed there, or reach out to our customer service team. I'll provide that number here in just a bit, but please reach out to them and they'll be able to provide you all of the answers you're looking for. ID cards. So here we have again the UHC member ID card, which provide all of the necessary information you need when seeking medical services. That includes your member ID number, group numbers, your assigned primary care physician will be listed on the card as well, including the primary medical group. Any general copays will also be listed on the card, including if you have a applicable deductible or out-of-pocket maximum on your particular plan, that will be listed on your card as well. Now, on the back of the ID card, this also houses all of the general contact points members can utilize for assistance. So that will be, again, the dedicated customer service number for all VIBA members will be listed on there. So I can just give it out now. It's the 888-586-6365. It is on another slide later, but I figured I'd throw that out there. As well as the mental health support number and any provider support numbers as well. If your providers need to call in to verify benefits or answer any questions, that is also on the back of the card. On the back of the card, you'll also find a claims address. For instance, for some reason you had to pay out of pocket and you needed to mail in a claim form and show proof that you made payments and you'd like reimbursement. That address is on the back of the card as well, where you can mail in that claim form. Now, just a reminder that I like to throw out there when it comes to ID cards, that anytime there's a change of the information listed on the ID card, a new one will be generated and sent out within 7 to 10 business days of that change. So you want to make sure once you make any of those changes and you're advised that your new ID card will be sent out, again, at 7 to 10 days, you want to make sure that you throw out that old card just to avoid any mishaps when you go to the doctors, being charged the wrong copay or verifying wrong information, whatever it may be that was changed. You always want to make sure, so you give out the right card, throw away that old one, again, to avoid any of that confusion when seeking services. All right, so next we have the myuhc.com website. So this is the UnitedHealthcare member portal. On this site, you can view things like claims, bills, referral status. You can change a PCP. You can search our network for providers. And this is also where members access a lot of the wellness benefits to sign up for them, or even, let's say you're looking to have a virtual visit. You want to print a temporary ID card. This is the hub of all that information for you. Now, if you are a UHC member and you haven't registered, all you need to do is go to myuhc.com. Have your insurance card handy because it has all of the information on there that you'll need in order to register and create a profile. There is also a MyUHC app available that you can download directly to your phone. It has all of the same information and available benefits as the website on that app. So again, I highly recommend downloading that or accessing MyUHC because it's a great program or a great system to use and benefit you as a member. Now, the one other key thing I like to add when it comes to the MyUHC app is if you're like me and like to lose your ID cards or and some reason you misplaced them, The app does have a digital ID card available. Through the app, you have a digital ID card, and that digital ID card is updated within 48 hours of a change. So if you're waiting for a new ID card in the mail and you have to wait that 7 to 10 business days, but you have an appointment, in a few days, that digital card will be available within 48 hours for you. So you don't have to wait for it to come in the mail, and you can still show it at the doctor's office whenever you need. So again, a great resource to have just in case, or even if, like I said, you like to lose your ID cards like I do, you have that digital one available whenever you need it and can pull it up, because we don't lose our phones. We always have those handy. All right, virtual visits. So again, virtual visits, I mentioned a bit ago, but this is where members can skip the lines and wait times of the doctor's office or urgent cares. You can access care from your phone or a computer 24/7. There's no appointment needed. We have 4 contracted provider groups in network for you to choose from. Those are Optum Virtual Care, excuse me, Amwell, Doctor on Demand, and Teladoc. Those are the 4 providers available for you through virtual visits. Now, it's great for treating things like rashes, pink eye, sinus infections, flu, bronchitis. The list of available services that you can receive through virtual visits is continuously growing. So it's a wonderful benefit. Highly recommend utilizing it. And again, how you access that is through myuhc.com or through that MyUHC app. So again, not just another reason why accessing those or registering on MyUHC is something to do. Next slide. Perfect. Able to. So Able to is actually one of our newest programs offered by UnitedHealthcare. This is a virtual behavioral coaching program. It's great for managing things like stress, anxiety, or depression. And basically what it is it's a dedicated one-on-one weekly coaching call via phone or video chat with the coach or therapist. And what it offers is in-app messaging as well in between sessions. So that's one of the greatest benefits about this program is, from week to week, the things that we would like to discuss with these coaches or therapists don't actually always happen on those days that we have a call set up, so this allows you to have a conversation in between sessions with that same individual that you are having a coaching or therapist session with. And it works based on a program called CBT, which is cognitive behavioral therapy, that's the technique that they base the program off of. So it's a wonderful program. Like I said, there's 8 one-on-one week sessions. And again, I highly recommend members to take advantage of this. You can access this by going to able2.com and get a lot of good information. There's actually a QR code there as well, which will take you directly to a website where you can gain more information and how to access setting up your sessions. Perfect. So here we have the exciting OnePass gym membership program. So OnePass is a subscription-based fitness network of gyms and studios available to members. And the great thing about OnePass is it offers the freedom of choice between 4 different tier options that are available. Those tier options are known as Total Fitness, Universal, Premium, and Ultra Fitness. Now, each tier ranges in price, but the first tier begins at $25 a month. It does go all the way up to $139 a month, of which all of them have 0 enrollment fees. So each tier offers what we call multi-location access, where members have the freedom to change locations at any time, and the ability to access all of the amenities and services that each gym offers, including all of the classes that they offer as well. So it really gives you, that freedom. Let's say that you're traveling, or you're, some locations have limited classes. You're able to sign up for a different gym and access all of the classes that they have, as long as they're within the tier that you select when you sign up. So it's a wonderful program. A lot of great feedback on this. So again, we're definitely one to look into, especially if you have a gym pass currently, to see where yours falls, and great benefit. All right. Chiropractic and acupuncture services. So always one of the favorites. So new in 2024, chiropractic and acupuncture services will now be available to all VIBA and UnitedHealthcare members. This coverage is offered through Optum Health. It includes unlimited visits, but the visits are subject to medical necessity. Your copay will be in line with your PCP office visit on the plan that you elect. So if you're looking to utilize these benefits and find an in-network chiropractor, acupuncturist, you want to make sure that you're utilizing the Optum website. It's listed there. It's the My Optum Health, physical health of ca.com. So again, that's where you find all of the in-network chiropractors and acupunctures doctors. You don't go to the same network site that you currently find your medical providers. This is the specific site that you'll have to go to. And when searching, you want to make sure that the plan product section, in the plan product section, you select California Schools VIBA. And this will narrow down the doctors to make sure that you're getting the specific in-network doctors for the plan available to VIBA members. All right. And again, that's the My Optum Health, physical health of ca.com. That's the website that you want to make sure to go to find all of the in-network providers. All right. So as a reminder, UHC is always here to help. We have dedicated teams standing by, waiting to help with any questions or issues our members have. So again, we have that dedicated VIBA member customer service number. It's at 888-586-6365. We have the behavioral health customer service number. And again, these numbers are on the back of your ID card, but I like to throw them out here just in case you have a question now, and maybe you're looking to call in and ask a question. Behavioral health customer service, the 888-625-4809. The member site for the All County of San Diego members I mentioned earlier, it's that yuhc.com/COSD. And again, our MyUHC member website, myuhc.com. All right. Well, thank you very much, everybody. And I will go ahead and pass it along to, I think Matt will introduce the next speaker.
Nick, thank you so much for that presentation. We really appreciate it. We're going to go ahead and talk about the UMR PPO plan. So to do so and talk about the additional benefits through UMR, I'm going to turn it over to Rochelle. Rochelle, it's all yours.
Thanks, Matt. Good afternoon, everyone. My name is Rochelle Rabuco, and I am the UMR Dedicated Account Manager or Field Account Manager. And my purpose here today is to present you with your PPO benefits, and along with some of the tools and resources that's available to you with your UMR PPO medical plan. Next slide. First thing I want to talk about is what or who is UMR. So UMR is a third-party administrator that provides employers, and health benefit plan members with services to help them get most of their benefit plan, or get the most out of their benefit plan. UMR will assist in managing the benefit plans on behalf of the California Schools VIBA for County of San Diego. And our main goal is to provide you and your family with timely, accurately caring services. This includes medical claims processing. We also help coordinate care if you are in a hospital or dealing with a chronic health condition. Next slide. All right, so what is a PPO, or your PPO plan, the value that's connected to you? So you have the PPO network through UMR, and the PPO network is are providers that are contracted with UnitedHealthcare. They're a group of doctors and hospitals and other healthcare professions that are who offer network discounts on the services that they provide. A great benefit to you is that if you go to an in-network provider, is basically cost savings. When you receive a care from an in-network provider, the plan typically pays a bigger portion of the cost and you'll pay less out of pocket. Another benefit is your ability to self-refer, which is basically your freedom of choice. If you enroll in the PPO plan, you have the flexibility to switch to a different primary care physician at any time, and you can see a specialist without a referral. So this could be if you decide to go to see a dermatologist or a gynecologist or an infectious disease doctor, you do not need to get a referral to see them with a PPO plan. All right. Next slide. Here we have an overview of what your PPO benefits offer. So as you can see over here, we have your deductible for an individual at $300. For family, it's $600. And then for your out-of-pocket, an individual would be $2,300, $4,600 for a family. And for insurance, your co-insurance, the plan pays at 80%. And then you can also see here that if you were to go to do an office visit for a primary care physician, it will just be a $20 copay per visit, or for a specialist, it'll be a $40 copay per visit. And as we mentioned before, your pharmacy is with Express Scripts, and Amy will be able to tell you more about what they offer on that. But just as a quick overview, we do offer the $10 generic from under Express Scripts, $20 for preferred, and $35 for non-preferred brands. Next slide. It's a continuation of your benefit plans. As you can see here, I apologize. If you were to ever be hospitalized, you will have a $150 copay per admission, and then it'll be 80% paid by the plan after the deductible. It's $75 copay per visit for urgent care. 125 copay per visit for an emergency room care. And we also offer therapy services such as occupational, physical, or speech therapy at a $20 copay per visit. And there is an annual unlimited visit, but will require a medical necessity approval after the 30th visit. And then you also have your preventative care, screenings, and immunization at zero copay per visit, and a deductible will be waived. And we also offer virtual visits through Teladoc at a zero copay per visit. And yep, next slide. Thank you. As here is, again, an overview of your UMR ID card. You have basically on the front of your card, you will be able to see the member ID number, which is assigned specifically to you to track all of your benefits and claims information. There's a list of the family members that will be covered under your plan. And then your medical provider network, also referred to as your preferred provider organization, that'll list it right underneath on here. That'll say it'll be your Select Plus. And then if you're going to the number, the number assigned to to identify your groups, the health plan is also on here. It's on the top right underneath the logo of California School Viva. And then you'll also be able to I apologize. It shows you the copay visits for office specialists and or urgent care on the front of your card. It'll have your $20, $40, $125, and $75 copays listed in the front of the card. And if you were to look at the back of your card, these are all the information for your out-of-pockets and deductible maximums. And it'll also have the dedicated 800 numbers for your customer service, your nurse line, your Carum Health, Express Scripts, as well as the claims address should you need to submit a claim. We do provide the address. However, if you do go on to the umr.com, we do have this form available online, and you would also be able to submit it in 3 ways. You can fax, mail, or submit it to a shared mailbox for quicker processing. Next slide. So as I mentioned, it's important that to remember that once you have access to the umr.com, after you've been enrolled, we highly recommend that you make this your first stop. In here, you will be able to you'll definitely want to have your member ID card handy, because you'll be able to go ahead and pull all the information that you would want to know about your plans in here. You will have access to see your benefits information anytime, whether it's on your desktop or a tablet. And again, we also offer a mobile app, so through your smartphone devices. From the My Menu tab, you would be able to check on your benefit highlights for your plan, the co-payments and co-insurance for you and your dependents, and you can see the amount of your office visits. You can get a review of the deductible and out-of-pocket amounts, and if you're close to reaching it. The website also gives you access to the explanation of benefits and view all of your medical claims. This is the fastest and easiest way to check the status of your claims, actually. You can also learn more about other medical conditions and treatment options. Now, to the right of the screen, you will also notice that there's a few things that you would want to, we would want you to know to help you get through the registration process. Like I said, you'll have to make sure you have your medical ID card with you, and when you have dependents or your spouse, we would encourage that they create their own profiles, their own login and password, because again, anybody who's over the age of 18 will be able to create their own profile, but they would be able to also grant access for the information in order for the plan holder to be able to see the claims and benefit details on this plan. It just kind of basically tells you that, here's how there's a spouse or an adult dependent. They can create their own account on umr.com. After logging in, they select the account settings icon from the top of the page, and in the access privileges sections makes the appropriate security selections. I think and again, if you grant the access, this needs to be set up in the account setting, and so that your adult dependent and or spouse in the access privileges section of the site. Next slide. All right. So some of the resources and tools that we can have here is also when you are on the UMR website, you will have access to the online provider directory after you have become a member to quickly find a care for your need. You need to just simply select the find a provider tile, which is this little white tile with a little image of a doctor on here, and in the provider network tab, look for the provider network UnitedHealthcare Select Plus network, and you can start your search. Another way to look up the providers is by selecting I apologize. I already mentioned it to find a provider tile, but you can basically just look for your provider network on your ID card, find a provider network using that alphabetical listing, or you can do a search box. And again, you're defaulted technically to the UnitedHealthcare Select Plus network. And also you'll have the option to, the ability to do a mental and behavioral health providers, including for counseling and substance abuse, just by selecting the behavioral health tile tab. And it's the little white tile with the little, looks like a head with a brain, emphasis on the brain. This link will direct you to the Live and Work Well provider website. And you can also call our UMR toll-free number at 1-800-826-9781 to get assistance if you're having trouble finding a provider, or if you're checking to see if a provider that you currently have is in the UnitedHealthcare Select Plus network. We will have our customer first representatives to help you find an in-network provider if you're unable to do so on your own. Next slide. As I mentioned earlier, we do have a mobile app. It's called UMR on the Go. You can download either using the QR code in the bottom of the screen, or just, again, you'll be able to simply scan the QR code or visit the App Store to get started on downloading this information. And having the mobile app allows you access to your digital ID card, be able to look up healthcare providers, find out what your copay for your upcoming appointment will be, view recent medical and dental claims, chat, call, message UMR member support team using that app. And as Nick said, for those that constantly lose their ID cards, this is a great way of being able to pull up that information. You can actually email the ID card to your provider's office ahead of time. I mean, even the day of your appointment, they will be able to have that at their fingertips. And on here, as Nick had mentioned, kind of like with PPO, if you are to get changes to your ID card, it will take about 7 to 10 business days for a new card to be mailed out to you, but you are able to pull a updated card through the app within 48 hours. Next slide. A couple more resources or functions that's available to you under UMR is being able to choose a primary care physician. So under a PPO plan, it's not mandatory to have a PCP or a primary care physician, but we do highly encourage that you choose a primary care physician with your PPO plan. And that's only because the provider can basically help manage your prescriptions, medications, and also, once you establish a relationship with your PCP, you can ask them for advice and information on healthy behaviors and treatments, options, and self-care. And even if the plan doesn't require like a PCP, referrals to specialists is always a great way to check with your PCP. And they can also recommend a specialist. But again, it's not required, and you do not need to have a referral to see a specialist if you need to see one. To the right, there are certain services that are covered in advance, and this is on just the instance that you need you end up in doing a hospitalization. There are certain services that we authorize that would require medical necessity services. We basically just, if you know that you're going to have surgery, we encourage you to basically plan ahead, call and check to see if it would require a prior authorization, or if a dependent is planning to be, admitted to a hospital or any kind of outpatient services. It's just it may require a prior authorization, but we do encourage that you just call ahead. And as you can see, we gave you a list of a couple of things that might require prior authorization, such as inpatient surgeries, chemo and radiation, dialysis, and cosmetics procedures or clinical trials. And this is just to help see if it requires a prior authorization, because we wouldn't want you to show up at a hospital and then they tell you that it wasn't authorized ahead of time. So this is, again, something that you can just do prior to, if you know you're going to have some kind of inpatient or outpatient services that may or may not require authorization. We just want you to know that you can call ahead and find out if it is required, and then we will be gladly to help you get all the prior authorizations in place for your hospitalization or outpatient service. Slide. So we also mentioned that you do have a virtual care. We do have it through Teladoc. And so you have this access for telehealth through Teladoc, and you can basically talk to a doctor anytime, anywhere, and you would receive a quality care by Teladoc Healthcare doctor just by connecting by phone or video or the mobile app. You'll be able to be assisted in 10 minutes on an average, and a network of doctors can treat every member of the family. I actually was on a call a couple of weeks ago where a Teladoc representative had mentioned that they had gone on a travel and they had a newborn baby with them. And again, they're in a new city or a strange city, and it was like 10 o'clock at night, and there was something wrong with their baby, and they were panicking. And what they did is they just used the Teladoc app, and they were able to get connected with a pediatrician that basically they explained their symptoms, and the provider on the phone was basically able to give them some assistance and let them know that it's nothing that to be alarmed about. They just need to, get like some kind of medication that they can put, and then that they can follow up with, their regular doctor once they go back home. So it was something that helped them be put at ease by using the Teladoc feature. Again, they were traveling with a newborn. So it's something that's here you can use it for like general health, cold symptoms, flu, allergies, sinus infections, like I said, pediatric care. But you also have the option of being able to pull specialty care, such as a dermatologist or a behavioral health therapy. And with a dermatologist, they will just, there's a screen that basically asks you if you're here to see a dermatologist. They will ask you to take a couple pictures. Everything can be done through your mobile app. And again, you can get consultations just by visiting the teledoc.com website or call the 800 number for Teledoc to get assistance. Slide. One more feature that we have is we also have what we call the nurse line. So this is a call to the UMR's nurse line service will connect you to a team of registered nurses who can answer your questions and provide advice. Our nurses are standing by to help anytime in the day, 7 days a week. And we have nurses available to chat live with you online at umr.com, or you can talk to you over the phone. Best of all, it's part of your healthcare benefits, so there's no cost to you to utilize NurseLine. They can answer questions like what preventative screenings would you need? How can you learn about a new diagnosis? Would an over-the-counter medication help? Should I go to the emergency room? This is extremely helpful if you find yourself in late and sick with a child, like as I mentioned with a teledoc. Again, this is like another option for you and your dependents to be able to use and get like any kind of diagnosis or just basically call in for some assistance. And like I said, our nurses are standing by to assist 24/7, 7 days a week. And the number you can call is the 877-950-5083. And last but not least, we have our regular UMR 800 number for your member services if you're interested in calling. Again, we offer our customer service by calling the 800 number, or you can go to our umr.com, and there's also an email and chat features, whatever is more comfortable for you and your dependents. And yeah, and we're all just standing by to help you. And if you have any questions, feel free to let us know. But I wanted to say thank you for your time and letting us present your PPO plan to you. And I'll turn it back to Matt for the next presenter.
Thank you so much, Rochelle, for that. Really appreciate learning about the UMR PPO plan. To talk about your pharmacy benefits, I'm going to turn it over to Amy Williams, who will be talking to you. She is with Express Scripts. Amy, it's all yours.
Great, thank you. Hello, everybody. As Matt said, my name is Amy Williams. I'm an account manager here at Express Scripts. I'm going to take a few more minutes of your time here to kind of go over your pharmacy benefit. Express Scripts manages your prescription benefit on behalf of the County of San Diego and California Schools VIBA. Express Scripts helps patients access affordable prescription drugs safely and efficiently. Each year, as a leading pharmacy benefit manager, Express Scripts saves approximately $32 billion for nearly 100 million Americans and thousands of clients that we serve. We're here to help you better live better, simpler, or find better, simpler ways, thank you, to manage your medication and then your health. Express Scripts is committed to providing you access to proven medications at an affordable price. The medications on your drug list, also called a formulary, are covered by your prescription plan and are routinely reviewed by an independent panel of physicians and pharmacists to ensure that you receive clinically effective care. The medications on your prescription drug list are known as preferred medications. They include both generic and brand name medications. If you fill a prescription for a non-preferred medication, you will have a higher copay. Certain medications are excluded from your drug list, which means that they are not covered. In most cases, if you fill a prescription for an excluded medication, you'll have to pay full cost for that medication. So again, if you find that you're using a non-preferred or an excluded medication, please talk to your doctor about moving to one of those preferred alternatives to help you, of course, save money and have coverage under your plan. There is always those certain rare instances to where you have to take that drug that is, say, excluded under the benefit. And so just know if that is something that pertains to your therapy, that your doctor is able to request a review for an exception, also called a prior authorization, that I'll touch on in a future slide. To help you stay healthy, you can receive vaccinations, including the COVID-19 vaccine, covered by your prescription plan at a participating retail pharmacy. So you can call your local pharmacy to ask your pharmacist which vaccines are right for you, to find out if your pharmacist can administer the recommended vaccine, and to learn which vaccines are covered by your plan. And of course, if you do get your vaccine at your local pharmacy, don't forget to present your Express Scripts ID card to the pharmacist. When appropriate, we encourage you to consider taking advantage of generic prescriptions. FDA-approved generic medications contain the same active ingredient as brand name counterparts and are just as effective. Millions of people use generics. In fact, 9 out of 10 prescriptions filled in the US are for generic medications. And generics typically
Amy, Matt, are you both still there? I believe Amy is frozen on my end.
Yeah, I think we did lose Amy on there.
Okay.
I think I'm back. Can you hear me okay?
Yep.
Welcome back.
Sorry about that.
Thanks, Amy.
I lost connection. The joy of being virtual, everybody. Sorry about that. And so it's going about generic prescriptions here. Hopefully that doesn't happen again. Sorry again about that. So it's also important to note that a generic equivalent contains the same active ingredients as the brand name version, whereas a generic alternative is similar to the brand name medication, but it's not the exact same formulation. So it could be a different color, shape, or inert ingredients. So be sure to review your medications regularly with your doctor or pharmacist, and always ask if there's a generic for that. You can also use one of our digital tools, which I'll touch on later in this presentation, to find out if there's a generic alternative available for a brand name drug that you are prescribed. Prior authorization monitors prescription medications to make sure that you're getting a prescription that is suitable for the intended use and covered by your prescription plan. If your pharmacist tells you that your prescription needs a prior authorization, it simply means that more information is needed by your doctor to make sure your plan covers this medication. Only a physician can provide this information and request a prior authorization. So like I mentioned earlier, it could be those instances where you need to ask for a coverage review if for a drug that's excluded under the benefit that you must take for your therapy. That's an example there, as well as just simply a clinical review for certain specific medications under your benefit. Just make sure we keep that connection in place and communication in place with your physician. Drug quantity management verifies that the correct quantity, either tablets or capsules of a medication. It ensures that the most cost-effective product strength is dispensed, and this helps reduce waste. So when you prescribe certain medications that are part of a drug quantity management program, Express Scripts is going to make sure that you receive the amount or quantity considered safe and effective by the U.S. Food and Drug Administration, or the FDA. And some examples of this might be opioids or controlled medications, just as an example here where this would apply. While new members will receive an ID card in the mail, I wanted to point out to you that you are able to access your ID card virtually as well, just as the other providers here we're talking about today. There's an app for almost everything nowadays. Your prescription ID card contains important information about your prescription plan, benefit plan, and a customer service telephone number that you can call 24 hours a day, 7 days a week. You can easily create your digital profile at expressscripts.com or on our Express Scripts mobile app to gain access to your digital prescription ID card. You can view your card online or on the app, download it to your digital wallet, or even print a card from our site. Long-term medications are taken over a sustained period of time, like high blood pressure or cholesterol medications. So starting January 1st, you'll be able to get a 90-day supply of long-term medications, again, starting January 1st. So this is something that is new and a so-called improvement to your plan, that you have more options to fill these long-term medications. Currently, you're able to get a long-term 90-day supply via mail order. But starting January 1st, you can also look to participating in retail pharmacies that include Costco, Rite Aid, and Sharp Re-Stealing. So while you're not required to move your long-term medications over to a 90-day supply or to a participating pharmacy, you can experience a savings in copayment in filling one 90-day supply versus 3 30-day supplies. The copay is the same whether you fill a 90-day supply at home delivery from Express Scripts Pharmacy or at one of those participating retail pharmacies. If you choose home delivery from Express Scripts, your medications will be delivered straight to your door with free standard shipping. You can transfer prescriptions easily online, by phone, or via our mobile app. You can look into automatic refills, and you can, of course, talk to a pharmacist by phone 24/7. But again, just another quick recap here for this slide. You can use Express Scripts Home Delivery Pharmacy today and have been able to get a 90-day supply of those long-term medications. But starting January 1st, you have an expanded network. You can do home delivery, or you can look to Costco, Rite Aid, or Sharp Steely. Accredo is a specialty pharmacy which provides personalized patient care for members with a wide range of chronic and complex health conditions. A specialty medication is a medication typically used to treat chronic complex conditions like multiple sclerosis, cystic fibrosis, or cancer. Your Accredo team is here to make your path as smooth as possible and help you along the way. We do that by having specialty clinicians as your guide. Our specialty trained pharmacists and nurses are available 24/7 for any questions about your therapy. You'll receive one-on-one clinical support to help you administer your medication safely and effectively, and your Accredo team helps you manage possible side effects. For certain conditions, Accredo nurses also help administer medications. The route to getting medication is also easy. As allowed by law, free shipping is there to where you choose. Medication is handled with care, including refrigeration if needed, and you can order refills on Accredo's own digital tools, accredo.com, and they also have a mobile app as well. Accredo also helps support you with billing, helps navigate, of course, the insurance coverage through Express Scripts as your pharmacy benefit manager for the county, and will also help you with financial assistance, such as copay assistance, manufacturer assistance that might be available as well for your medication that you're prescribed. I touched on this a little bit earlier, but bring up into one slide here. There are a lot of resources available to you to support you. The Express Scripts mobile app, it can be downloaded for free. Simply go to your mobile device's app store and search for Express Scripts. You can create your digital profile on expressscripts.com or on the mobile app. It can help connect you to, again, your digital prescription ID card. You can do price and medication tool to find those lower cost medication options. You can find nearby and network pharmacies. You can enroll in automatic refills with home delivery. And you can also, if you do home delivery, continue to use one of these tools for order tracking. If you have any questions or need more information about your prescription plan, you can contact member services. So again, that number is on the back of your ID card. Just general support, they can get you in touch with a pharmacist or as well as Accredo, a specialty pharmacy, if that is where your medication is being dispensed from. And I think that rounds it up for me. So I thank you for your time today. And I'm sorry for that little blip in a technology there. Thank you.
Amy, no problem. Thank you so much. Appreciate that. So we're going to transition a little bit more to this is going to go over all the additional resources that are available to VIBA members. The first one that gets questioned about all the time is out-of-area nationwide access. So currently, what is currently in place for out-of-area coverage, whether you're a dependent student who is residing out of area, or if you are a early retiree who is looking to move to another state, then if you are wanting to stay on the county's plan, then you can go ahead and get out of area coverage. We would put you basically on a out of area PPO plan. So if you have retirees who are moving out of state, you would just simply provide the county with your address and we would automatically put you onto the out of area PPO plan. And then basically you would get new ID cards. And this is a nationwide PPO plan, so you can access care all over the nation. For your students, currently for the 2023 plan year, then we would also put them on this nationwide PPO plan. You, the subscriber, would remain on the HMO plan, or if you're currently on the UMR PPO plan, whichever plan you elect to enroll into. If you have any dependent students who are going away to college, then they are put onto that nationwide PPO plan as well, and they would just pay different out-of-pocket services at the time of service. Your premium, meaning what your monthly contribution would be, remains the exact same, but your dependent who is living out of state will basically stay on this out-of-area PPO plan until they either move back permanently or they age out at the age of 26. So new for 2024, we're really excited to announce this because right now for your dependent students who are currently going away to school in a different state, they're on that nationwide PPO plan. They basically have a plan where they have a deductible tied to the plan. They're also going to have a co-insurance, meaning that your insurance provider pays a certain amount for the services that they utilize, as well as the out-of-area dependent would pay a portion of that. And usually it's 80% for the insurance company and 20% for the student once that deductible has been met. What we're excited to announce in 2024 is we have partnered with Surest for your out-of-area dependent students that they will be able to access the same network of providers. So they're basically going to be able to access all the same providers that are on the out-of-area PPO plan, so it's the same exact network. The only difference is we really didn't want costs to be a burden for your out-of-area dependent students. So we've partnered with Surest, which is a portion of UnitedHealthcare that allows students to be able to access care at much more affordable costs at the time of service. So the way that it works is if you have an out-of-area dependent that is going away to college, let's say, and what you would do is you would provide the county with that dependent's address. Then basically what will happen is we will put them onto the Surest program. They will still have the same access to the network of providers. However, instead of paying a deductible or a co-insurance for a time of service, they're now going to pay flat co-pays. And they're going to be able to do that through the Surest digital platform. And so when you get enrolled into this plan, they're going to get a new ID card, and basically they'll be able to pull up the Surest platform, and then they can go ahead and start seeking services in the state that they want to, or that they're residing in. So for instance, if I'm residing in, let's say, the state of Texas, I'm under my parents' plan, I'm going away to college, I need to access care. Then I would go onto the Surest digital platform. I would go ahead and look for providers in my area. And I can go ahead and put in whatever symptoms I may need to have access to. Maybe I have the flu, or maybe I have a cold, or maybe I broke my arm or my leg or cut myself and I need to see a provider. You'll be able to put in those services that they have. And then through Surest, what they're going to do is it's going to populate a bunch of network providers that are in your area. Sort of similar to like if you go onto Yelp for different restaurants in your area. It'll provide different providers in that student's area. And then basically what they will be able to do is they will see the price of what they will pay for the time of service. And this will be in the form of a copay. So this would be like a $20 visit or a $30 visit or a $40 visit. And the dependent student can go ahead and pick and choose what provider they want to access. They'll be able to lock in that price. They'll be able to schedule the appointment and then go and see that provider at that appropriate cost. So this is a great way for your dependent students to be able to access out-of-area care while they're residing out of state. Now, whether you enroll into the UHC HMO plans or the UMR PPO plan, you are automatically a VIBA member. And being a VIBA member means there's a lot of additional resources that are available to you and your covered dependents at no additional cost. The first one being the access to Kindbody. We're really excited to partner with this. This is brand new for 2024, so this will take effect 1/1 of 2024, that your members currently will have access to Kindbody, which is a fertility solution benefit. Right now, under the plans with UnitedHealthcare or the UMR PPO plan, you do not have coverage for fertility solutions, meaning you, the employer, are responsible 100% for the costs of any fertility treatments. So beginning in 2024, we've partnered with Kindbody, where you actually have the ability to get fertility services covered at 100% for one kind cycle. I'm going to talk a little bit more about the kind cycle, but as you know, fertility treatments can cost quite a bit of money. I mean, the treatments can be anywhere up to $20,000, and then the procedures themselves, they can get into the tens of thousands of dollars. And so KindBody really is here to work with you on your fertility solution benefit. So depending on whatever stage you have, they are here to cover you for all stages that you have for your fertility quest. This can be anywhere from, hey, maybe I'm considering infertility and I want to look more into it. Then you can reach out to them. They can begin the beginning stages with you, answer your questions. They can help, with preserving your egg, your embryos, freezing your sperm. They can also assist you with family builders. This would be, fertility type treatments. And then, any expecting parents. So if you have any expecting parents, then you can reach out to KindBody as well. They will assist new patients. If you've currently are working through fertility solutions, you can reach out to them. They can provide you guidance as well. And they can even assist you with the live birth process, and then anything that has to do with post-fertility. So they really are here for, all the way from the beginning of, hey, maybe I have some questions, to I've had my child and I want to talk a little bit more about post-fertility, what to expect after. They have you covered all the way through. They think a lot of the same ways as Viva. They use very, very much holistic type approaches. They're very customer friendly, where they are really here to cater for you, the members. So where are KindBody locations located? Well, as you can see here, they're located all over California. But if we focus in on the San Diego County, then their signature clinic is set to open in Q1 of 2024. So they're working on some facilities where they will have signature locations. I believe they're going to open up two, one of them being in La Jolla. The other one I don't think has been disclosed quite at this time, but as we get more information, we will go ahead and let you know where their locations are. However, they have other locations in San Diego County that they partner with. These include Del Mar, Mission Valley, Camino Real, and then the Reproductive Sciences Medical Center in San Diego. So these are clinics where you will have the ability to go and seek KindBody services for your fertility solution, and they will be able to provide you with the KindBody experience as well. Also, not only are they here to assist you with your fertility solutions, they're here to assist you with menopause support as well. Menopause, we understand, is not an easy thing to go through, and so KindBody really can go ahead and assist you with, menopause support. They can assist you with nutritionists, therapists, coaches, and more, and they can really help you through your entire menopause cycle that you may be having. They can help you with, looking for in-network providers, your results, prescription hormone therapy if needed. There's patient navigators, there's a whole menopause community and more. And basically, they can help you through your entire time that you're going through menopause. So not only fertility solutions, but also through menopause. So KindBody, so basically eligibility and coverage. Who is this available to? So currently, if you are enrolled into the UnitedHealthcare HMO plans or the UMR PPO plan, or if you enroll into the SIMSA plan, then you will have access to one kind cycle. What do I mean by one kind cycle? Well, one kind cycle is going to be basically anywhere from beginning consultations to fertilization to the actual insemination, any treatment, and then any post-treatment follow-up that is needed through the live birth and everything. Viva is going to go ahead and sponsor that 100% as long as you go through one of the KindBody clinics. Basically, if you need to access more than one KindBody full cycle, then you will be able to go ahead and utilize KindBody. However, at that point, it will be at a discounted rate. And we'll see discounts of up to maybe about 20% on certain covered services. So great news, that as long as you are seeking fertility solutions through KindCycle beginning January 1st of 2024, Viva will sponsor one full kind cycle, meaning anywhere from the beginning process of questions all the way to post-fertility treatment as well. That will be covered at 100% for the member as long as you go through KindBody. So really exciting news for the 2024 plan year. Also, a new benefit that's available to you is whether you're on the UnitedHealthcare HMO plan or the PPO plan, with your pharmacy benefit manager being through Express Scripts, then Express Scripts has partnered with GoodRx, and that's through their Price Assure program. Basically, we want to make sure that you are getting the lowest cost in prescription drugs at the time of service when you go to the pharmacy. And so a lot of times you've heard about GoodRx, you go out there, you've seen the commercials, they provide discounts on medications. Well, basically what is going to happen now is when you show your Express Scripts ID card at the pharmacy, then basically through Price Assure, they're going to match the price with GoodRx, and you will be able to get the guaranteed lowest price, whether it's the GoodRx price rate or the Express Scripts GoodRx price rate, for your generic medication. So basically, it locks in and ensures that you are getting the lowest copay for your prescription drug coverage. Also, through Express Scripts, then there are waived medication copays for hypertension, diabetes, and high cholesterol medications. We've taken a look at the overall VIBA pool, and we noticed that about 20% of the members are currently taking these type of medications on a current and annual basis, basically their long-term medication. And so we never wanted costs to be a burden for these. This isn't something new for 2024. It's already in place, but we want to remind our folks that, through Express Scripts, as long as you fill these generic type of medications, whether it's hypertension, oral hypoglycemic medications, and preferred generic cholesterol medications, then you're going to have a $0 copay as long as you go through the Smart 90 retail program or the mail order pharmacy. As Amy had mentioned before, then the Smart 90 retails are going to be Costco, Rite Aid, and then Sharp Steely pharmacies. And then also, if you access this through mail order as well, then you will get these type of medications at a $0 copay. Also, through Express Scripts, you have access to the Save on SP program. The Save on SP program are for members who are taking any types of specific type of chronic medications. Basically, if there's any type of specialty medications where you're having them filled up through a Credo, we know that these prescriptions, the retail costs of certain medications can be into the tens of thousands per prescription, all the way up into, 6-digit figures for one medication. And so we never really want costs to be a burden on these programs as well. So if you're having any of these prescriptions filled through a Credo, then you can sign up for the Save on SP program. And basically you can get these medications at much lower copays, anywhere from no copay to very minimal copays, $10, $5 copays, things like that. And so all you would need to do is go to saveonsp.com/VIBA to go ahead and get started, or you can call them to enroll. Want to remind you that we would love for you to come and join us for getting your flu shot. Flu shots are covered at 100% for your population who are enrolled into the UnitedHealthcare HMO and PPO plans. And so we are offering flu shot fairs located all over San Diego. There are different times and dates. So here's just a small sampling of some of the different locations that we offer. In fact, last week we had one at our VIBA 2 location, which is located 1 block south of the County of San Diego's main campus. However, we are having flu shot fairs located all over San Diego County. And so if you'd like to go ahead and join one of these, take a look. We've provided the county with a list of all the upcoming flu shot events. Please feel free, come by, stop by, get your flu shot administered at no cost. There's also additional health screenings with the partnership of Kaiser and UnitedHealthcare. Then we are offering additional health screenings where you can go ahead, get numbers for like biometric screening, script strength, and things like that. There's lots of different screenings. There's going to be even, handouts, giveaways, informational flyers, raffles. There's even going to be a shaved ice truck as well there. So you can really come hang out and get your flu shot administered and see everything that VIBA has to offer. As Nick had mentioned before, chiropractic and acupuncture benefits are provided by Optum. So I'm not going to touch base on this slide too much, but really what we want to let you know is that you will need to go to myoptimhealthphysicalhealthofcalifornia.com. You're going to use that access code California Schools Viva to access an acupuncturist or a chiropractor. As long as you use one of their in-network providers, then your PCP copay, whatever it is, and you can see that in the green box that I have, is going to match what your copay is going to be for your chiropractic and acupuncture. So if your primary care physician copay is anywhere from $0 to $10, then your chiro or acupuncture copay at the time of service will be $10, and then moving down to $15, $20, and then $25 and more. So whatever your PCP copay is will match with whatever your chiropractor or acupuncture will be at the time of service. Wanted to remind you that you do have unlimited visits and you do not need a referral. The unlimited visits are subject to medical necessity as long as you go to one of those in-network providers through MyOptim Health Physical Health of California. The VIBA Advocacy Department. The VIBA Advocacy Department is actually one of my favorite departments that I work with pretty much on a daily basis, and they're really here to advocate for you. Sometimes navigating the healthcare system can be quite difficult. You're contacting carriers, you're contacting the doctor's offices, you're contacting 800 numbers, you're being bounced around from phone tree to phone tree. You're not getting the answers that you're trying to get the answers to with regards to your healthcare. And so the VIBA Advocacy Department is really here to advocate for you. They can help you with things like access to care, quality of care. Maybe you received a bill in the mail and you're not sure why. You thought it was covered under a certain copay, let's just say, but you're receiving a bill in full. Maybe you're having a hard time scheduling appointments, or maybe you're looking to transition providers. Maybe you're looking to switch plans this year and you need help with assistance with that, maybe with continuity of care, getting your prescriptions transferred over, things like that. They're really here. They're our in-house dedicated team to help get you the answers to those questions. They're available Monday through Friday from 8 a.m. to 5 p.m. I've provided their contact information down below and over to the right. However, you can always email them as well. They will go ahead and respond back to you as soon as possible and assist you with anything that you may need help with. You know, one example that I've seen with the advocacy department as an example is I've had members standing in line trying to get their prescriptions, and for whatever reason, the pharmacist isn't able to pull up the member's information. So they're being charged retail costs for that prescription. Well, that member has actually been able to step out of line, call the advocacy department, let them know what's going on, and then the advocacy department is able to provide the pharmacy with the member's information, and that member is able to get their prescription at the appropriate copay. That's just one example that I use of many, but they really are here to advocate for you. Teladoc Medical Expert Service. So this is a little bit different from Teladoc virtual visits, even though it's the same provider. Teladoc Medical Experts is a second opinion program that's available to you and your dependents at no cost. And the way I like to describe Teladoc Medical Experts is it gives you that second peace of mind. Maybe you're going in for an aggressive surgery, or maybe you've been diagnosed with a chronic condition. And before seeking treatment options, then you want to get that second opinion. Well, that's exactly what Teladoc does. What you can do is you can reach out to Teladoc. You can either call them with the 800 number, or you can go to their website and you will have a consultation with them. You'll let them know what's going on, everything. And then basically what they will do is, with your permission, access your medical records with whichever medical records that you want to share. And this could be anything from, consultations that you've had with your doctor or your specialist. It could be lab work. It could be x-rays. It could be MRI scans, whatever it may be. And what they're going to do is they're going to take that information and they're going to send it up to one of their world-renowned doctors. So they have over 50,000 world-renowned doctors, and they're going to look for a doctor in the area of expertise of whatever treatment option you're going through. For instance, I'll use an example. Maybe you need to have a knee replacement. So they're going to send your information up to one of their world-renowned knee doctors. That knee doctor will be in direct contact with you, and they will let you know if you're getting that right diagnosis, that right prognosis, the treatment options that are available to you. Maybe that surgery that you're about to have, maybe it's an outdated surgery, Or maybe you don't need surgery at all. Maybe there's an alternative form of treatment that, maybe wasn't discussed by your primary care or your specialist that you could seek services for as well. So Teladoc really does give you that second peace of mind, and they can even communicate with your doctors if you need them to as well. So this is one program where I hope you never have to utilize the services, but it really is great if you do need to use them. It gives you that second peace of mind. So whatever treatment option you decide to go with, you feel comfortable knowing you're making the best decision for you. Not only do we want to care for you, but we want to care for your four-legged fur burbies, I guess we could call them. So whether you have a cat or a dog, then basically through Inside RX Pets, you have access to select pet medications at a discounted price. You can see anywhere from 77% off generic medications and 15% off brand medications. And it's really simple to get started. You just go to InsideRxPets.com. You're going to go ahead and register. Once you've registered, you can go ahead and print your ID card, and then you can take that ID card to one of their 40,000 participating pharmacies, and whatever prescription drug that your pet is on, you could potentially get that at a discounted rate. Now, I have asked, and I do apologize, but flea medication is not included in this. However, there are a lot of different types of medications. You can always visit InsideRxPets.com to see the formulary. And if your pet is taking any type of medications, they could potentially get a savings on that. Carum Health. Carum Health is the next benefit we're going to talk to you about. Carum Health is embedded into the PPO plan offering through UMR. So this does not include the UnitedHealthcare HMO plans. Carum Health is included with UMR, those that are enrolled in the PPO plan. And so what Carum Health is it really is a concierge service for anyone who's basically going to be planning hospitalization or surgery for one of the select type of procedures. And that could be anything from a spinal procedure, orthopedic procedure, coronary artery bypass graft, also known as CABG, or bariatric surgery. So if you are enrolled into the PPO plan and you are planning hospitalization or planning to have surgery for one of these type of procedures, then you're going to want to reach out and contact Carum. And Carum, what they do is they evaluate different hospitals, doctors, the equipment that's used for these surgeries, what kind of readmissions they have, everything to post-surgery as well. And basically, they're going to go ahead and let you know who the best providers are for the type of surgery that you're about to have. So for instance, I'll give you an example. Let's go ahead and use that knee replacement again that I had mentioned before in a couple slides. So if I'm having that knee procedure, then maybe if I call Carum, they're going to refer me over to, let's just say, Hoag Hospital. And the reason why they're doing this is because they have really great surgeons that focus in on knee replacements. The equipment they use is state of the art. They basically have the lowest amount of readmissions for knee surgery. Then they're going to go ahead and let you know all that information. If you go ahead and you decide to use Carum, then basically for that hospitalization, the surgery, everything is going to be covered at 100%. So all your deductibles, all your co-insurances are going to be 100% waived. If you have to travel to that hospital or need lodging, or if there's certain meals that need to be covered, it's all going to be 100% covered by Carum. So just think of it as your surgery is basically covered for free, all the way through post-surgery as well. Now, if you decide you listen to Carum, you decide, no, you know what, the knee doctor that I currently have is the doctor that I want to use for that hospitalization, for that surgery, that is perfectly fine too. Basically, you would just say no to Carum and you would use the doctor that you wish to choose. And then you would just be responsible for paying what your out-of-pocket costs would be tied to the plan at that point. So great surgery benefit, or if you are planning hospitalization for any of these type of surgeries, we always recommend you call Carum first because your surgery could be covered at 100%. Finally, and lastly, I'm going to touch base on the VIBA Resource Center. So the VIBA Resource Center is available to all VIBA members. So basically, if you're enrolled into the UnitedHealthcare HMO plan or the PPO plan, you automatically have access to the VIBA Resource Center. We have 2 brick and mortar buildings that are available. One is in Hotel Circle South in Mission Valley, and the other one is in the Kearney Mesa location. And it's really like 1 block down from the County of San Diego's main campus. It's right there off Ruffin Road. And really what the VIBA Resource Center was here and designed for is it's really to assist you with whatever well-being challenges that you may have, whether it's physical, mental, emotional, or social. VIBA wants to provide holistic type of approach to treating any type of well-being challenges that you may be having. So when you come to the VIBA Resource Center, what can you expect to see? What is offered? So we have different types of movement classes that are available, as well as stress management, cooking and nutrition, personal and professional development. So some of these classes that you can expect to see would be like yoga, meditation, there's deep breathing exercises. We have sound healing classes. We have acupuncture / acupressure. If you've never tried that before, you can go ahead and try that for the first time as well. The VIBA Resource Center also has gym equipment in there. So there's like ellipticals, Stairmasters, there's different weights that are available in there as well. There's also massage chairs in there that you can utilize. So maybe, after you've done your acupuncture, you want to go ahead and sit in one of the massage chairs, or after you've worked out at the gym, then basically you can utilize one of the massage chairs. We have a full kitchen in there as well, where we do healthy cooking demonstrations by our very own Chef Leslie. She's absolutely fantastic. I don't know how she does it. She can take broccoli and make it taste like bacon somehow. So she does really nutritious type meals, and we record all these videos as well that you can take up. And then we have a lot of different financial workshops that you can take part in, counseling classes, and more. So really, it is a holistic approach for you to overcome whatever well-being challenges that you may need assistance with. Now, we understand that maybe sometimes getting to the VIBA Resource Center on a continual basis, a daily basis, a weekly basis, maybe even on a monthly basis may be a bit challenging for you. And so we do want to let you know that we do have our virtual classes available, or that our classes are available to you virtually. We have over 200 different classes each and every month that are available to you, your dependents, your friends, your family, all at no cost. You can share these classes with your coworkers. You can share them with your neighbors. You can share them with the people you like. You can share them with the people you don't like if you want to. And really, you can take part in as many of our virtual classes. Now, if you want to attend any of our in-person classes, you do need to be a VIBA member, which you would be since you're enrolled into the plans with the county. And you can access any of the resources at our physical locations as well. If you have a certain group that you would like to have a tour of the facility, or maybe you want to host a meeting at the VIBA Resource Center, be able to take a look, see what the VIBA Resource Center has to offer, then please feel free to reach out to us. We can always go ahead and accommodate you. We can show you the VIBA Resource Center. We can provide lunch for you and your staff as well. And you can even host your own meetings as well. And then we also deliver the resources out to your sites as well. So we have a very robust well-being team that works and partners with the County of San Diego on different well-being activities that are presented at your sites in partnership with UnitedHealthcare. One of the events that you may have recognized, I believe, was the where you guys had all the inflatable obstacles that you guys did the other day. I believe this was held last week, and I believe Nick was there on campus to talk about it. That was in partnership. We partnered with the County of San Diego as well as UnitedHealthcare to be able to provide that for your members. But if you ever want things like yoga or meditation on your site classes, then we always continue to work with the County of San Diego on providing these kind of classes as well. Care navigation. So care navigation is also available through the VIBA Resource Center for any folks that want more one-on-one type consultations. Our care navigators are basically nurse practitioners that will help you with whatever well-being challenges that you have and really work one-on-one with you on achieving your well-being goals. They're going to work with you on finding a routine or a program that really is meant to work for you, that can really assist you with whatever challenges that you have, and really helping you to live your happiest and healthiest lives. So if you are interested in reaching out to one of our care navigators, you can always go onto our site at vibaresourcecenter.com, and you can always request to speak to one of our care navigators. And then, as I mentioned before, our well-being team, we do have well-being consulting. So we do partner with the County of San Diego on bringing well-being resources out to your site locations and providing fun well-being activities. So you can always reach out to our consultants and see about any resources that we can bring out to your sites as well. You would just go to vibaresourcecenter.com/well-being. And then, don't take it from us, take it from our member testimonials. We have really great testimonials. I won't read each one of these, but we do get a lot of positive feedback from the Viba Resource Center, about all the lives that we've helped to, enhance and change and move towards a positive choice. And we're really here to help assist you, the members. So please feel free to reach out and utilize the Viba Resource Center. It's available to you at no cost. Finally, I just wanted to provide you with our contact information. So again, as I mentioned, we have our advocacy department. So any questions regarding navigating the healthcare system, questions about a bill, transitioning providers, etc. There are in-house dedicated team that's available to you Monday through Friday from 8 a.m. to 5 p.m. And feel free to reach out to them anytime. They'll be happy to assist you. And then we have some additional content like our carriers' phone numbers, things like that at vibaonline.com. With that being said, I am your dedicated account manager. My name is Matt Ogden. Feel free to reach out to me with any questions that you may have. I do want to provide you with my information here, as well as Heather Simonson. She is our Viba ombudsman. She's been with us for quite some time, and she is also here to assist you with any questions that you may have. With that being said, that does wrap up our presentation for UnitedHealthcare, UMR, and Express Scripts. I'd like to thank all three of our carrier partners for attending and presenting on behalf of each of your products. We really do greatly appreciate it. And then I do want to give a great shout out and thanks to the County of San Diego for allowing us to be here to present all the benefit plan options that are available to your members. So thank you guys so much. At this time, we would like to go ahead and open up with any questions that you may have. Nidra, did you have any questions that we could go ahead and answer?
We did have quite a few questions that came through the chat. However, your colleagues did address the majority of them. So
Okay.
Thanks a lot for all of that. We kept everything flowing. So we truly appreciate your time and everyone else's time, including our employees who made the time. So as Matt did mention, if you do have any follow-up questions, please reach out to Matt. You're also welcome to reach out to the benefits division, and each department has a benefits ambassador to walk you through your open enrollment decisions as well. So at this time, we will conclude the webinar, and I wish everyone a great rest of the day.